Dr. Robi Ludwig is a psychotherapist. She joins us with more on these studies. Hi, doctor. Good morning. Okay, we're actually going to start with a different one here, though. This is researchers in London. They looked at dozens of studies that involved what they're terming highly sensitive people, like people who are highly impacted by their environment. Like, let's say maybe like lights are too bright or someone else's mood changes and then it impacts them. Experts think that this condition actually impacts just under a third of people and that they're more likely to experience mental health problems. To walk us through this, how can you know if maybe you are highly sensitive? And do you think that information like this could lead to better treatments?
Absolutely. It's so important for therapists to consider this when they're working with patients to see a trend if they're highly reactive to their environments or the people around them. And for individuals to study themselves and see how they react when, let's say, they're in an environment that doesn't work for them, or on the positive side, that does. And basically, we teach people how to manage their sensitivities, how to set boundaries, how to decide what's good and not good for them, and also to stress the good side. Very often, these people are highly sensitive to positive experiences and very creative.
Let's talk about this study that's looking at how marijuana has become much more powerful. Researchers found the THC content of marijuana has increased by 5 times over the past 20 years. Wow. And this is actually having a stronger effect on our brains. And some people, it's causing psychosis. So explain exactly what THC is, and should marijuana users be cutting back or stopping using the drug, especially if they're seeing any symptoms like this?
Yeah, so what we're noticing with a higher cannabis level, that people are reacting with a psychotic reaction at times, which is hallucinating, paranoia, distorted thinking. And in some cases, this can trigger early schizophrenic-like symptoms. So the first thing that you want to do with this higher THC is to stop using it. In some cases, antipsychotic medications can be used for a brief period of time to manage the symptoms, and also cognitive behavioral therapy to help people understand the distortions in their thinking when they're under the influence.
Important information as this gets legalized in different places across the country. All right, doctor, finally, mention this one. Most of us, we're familiar with the phrase treat yourself, right? Well, for Gen Z, the treats even at some point are breaking their budget. They're really kind of taking some liberties here. A New York Times article looked at how common what they're calling treat culture has become. So tell us, is treating yourself important? Like, what's the right way to do this, or any signs that maybe you're treating yourself a little too much, like maybe you can't quite handle how much you think you need to have a treat?
Listen, I used to be a huge fan of little treats, and I understand it. It's a way of like giving ourselves a gift, and it's self-soothing to get ourselves that extra coffee that's expensive, or blow dry your hair, or whatever the case may be. But if you are putting yourself in financial harm's way. So financially, your budget really can't handle it. You're in a deficit, or this becomes the only way in which you can give yourself a little treat by shopping. That's something to keep in mind. We always want to have a balance. Yes, get the little treat, but the different ways in which we soothe ourselves shouldn't have to do with financially just purchasing something.
Good advice, Dr. Robi, as always. Thank you.
All right, we all know how hard it is to get out.